My name is Stephen Andracki. I'm a physician in Pahrump, Nevada, and I work there as a staff physician. Colorectal cancer is one of the top 5 cancers for people in the United States, and it's actually much more frequent in the United States than it is in underdeveloping countries. That is probably because of diet. Colorectal cancer means cancer of the intestines. We take out the small intestine because that's not a very common site for cancer. But the large intestine and the rectum is not an unusual place to develop a cancer. So they're lumped together as colorectal cancer. We can change the incidence of colorectal cancer by 1, exercise. As a matter of fact, it's predicted that 10% of colorectal cancers can be prevented by returning to a normal exercise program. 2, obesity is a major risk factor for colorectal cancer, and so changing your diet to a healthier diet is important. 3, having more fiber in your diet, more fruits and especially vegetables, is very important because that's probably one of the important links for prevention of colorectal cancer, is having more fiber in your diet. Next is alcohol. People who drink more than 1 drink a day are at higher risk for having colorectal cancer. And then red meat and refined meats, processed meats, for instance. Those people who have diets high in those components have an increased risk. So this is one type of cancer that can be reduced by change in diet and exercise. That's the important thing. We don't have signs or symptoms of colorectal cancer until usually it's substantial. That is anemia, that you actually have bled so much that your blood count drops, and that's a bad sign because it bleeds. Because it doesn't usually produce pain. It may cause a change in bowel habits, but maybe not, and it may or may not, and usually doesn't produce abdominal pain. So usually you don't know. Now that's why it's important to have regular screening. First of all, men and women get it about equally. Second of all is that there's a couple of groups, 90% are going to be start screening at age 50. 50 is a magic number for a lot of things. Age 50 is recommended you start with your regular screening depending on what you have. Although there's certain other type of groups of people who have family history of polyps and genetic issues and things like this, or if your family, if you have 2 members of your immediate family who've had colorectal cancer, you got to start it earlier than when they were diagnosed with it. But in general, we start at age 50. That's a good question because we're just starting to develop genetic testing, which is going to be a lot easier to do, and it's going to be a lot more palatable for most people to do. Right now we look for blood coming from the intestines, and that's what the test that you can have done in a laboratory, that you can pick up from the laboratory and you send it in. 2 is that you can have a sigmoidoscopy or a colonoscopy, which is probably the best way to look for it. And then you can also have barium minimum, which is not used very much any longer. And of all those choices, the colonoscopy is probably the best. Why? Because colon cancer is preventable. It's probably one of the cancers that's preventable with screening. Why is that? Colon cancer develops from polyps, from growths in the intestines, and those usually transform, given time, into the colon cancer. Not always, but sometimes they do. So if they see a polyp on the colonoscopy, a lot of times they can remove it then and there, and effectively you have reduced your risk, or you prevented a colon cancer. The polyps are just the growth of the lining of the intestine that can happen for a variety of causes. So we don't know that to be true. Maybe fiber has something to do with it. Maybe the use of high-dose aspirin may have something to do with it. Genetics may have something to do with it in certain types of people. But in general, we're not looking to prevent polyps. What we're looking to do is to identify polyps as soon as we can and to remove those to reduce the risk of ever having those change into cancer. The best treatment is to treat it before it happens. That is removal of the polyps. By the time you've had cancer, develop into cancer, develop into problems, then it's usually surgical treatment. You have to actually go in, and they're doing this better and better in Las Vegas. They can do this through small incisions and through small telescopes to remove sections without causing a large incision. In the past, it was the large incisions and a difficult recovery. So the technology is getting better, but basically surgical is still the best, and you may need, depending on if it's spread, chemotherapy or radiation therapy or a variety of other therapies.